My name's Ashley. I'm doing my head to toe assessment, and these are my papers. And I'm just going to leave them right here to check when I need to. Hey. Knock knock.
Hi.
Hello, my name is Ashley Green. I'm going to be your student nurse today. I'm just going to be doing a head to toe assessment on you. Is that okay?
Yep.
I'm just washing my hands here. And then I'm going to check the safety of your bed, make sure the bed's locked and the rails are up. Can I get you to tell me your name?
Gabrielle Long.
Okay, and your date of birth?
March 13th, 2000.
Okay, do you know what year it is?
2020.
And who was the president?
Joe Biden.
Okay, so you were A and O. And now I'm just going to get into going into a few questions about your health history. Do you have or had any current or past illnesses or diseases?
No.
Okay, family history of diseases?
Yeah, my mom has diabetes and so does my
Okay, do you have any allergies?
grandma. Yeah, cherries and curry butter.
How often do you smoke?
I don't.
How often do you drink?
I drink on the weekends.
Okay, and what kind of alcohol?
Tequila.
Okay, and how often do you illicit drugs?
Every day, marijuana.
Marijuana? Okay. How often would you say that you exercise?
Not very often.
Not very often? Okay, would you say that you have a healthy diet?
Yes.
Okay. Okay, so I'm just going to go in and get a set of vitals on you. So, first, if I had a temperature, your temperature would be 98.6, and then if I had an O2, it would be around 100%, hopefully. And first I'm going to take a look at your fingers and assess for any clubbing. No clubbing, and your cavity fill is less than 3 seconds on both sides. Okay. Next I'm going to perform a 2-step blood pressure. Okay. Now I'm going to listen. My blood pressure is 110/70. Okay, and next I'm going to take your pulse rate, your radial pulse, for 1 minute. Your pulse is 82 beats per minute, and your respiratory rate is 12 breaths per minute. So now we're just going to move right on into the head to toe. If I can see your arms. Your muscle tone is equal bilateral. Your temperature is warm. I see you have a few moles. Are you concerned about any of those?
No.
Okay. No cuts or bruises. I'm just going to go in and take your brachial pulse. And then your radial pulse. Both pulses are equal bilateral and +2. I'm going to do a few range of motion exercises. Can I have you circle your wrists? Okay, can I have you lift your arms up? And I'm going to have you resist me pushing down, resist me pushing up, resist me pushing in, resist me pushing out. Okay, and then can I have you do a swimming stroke with my hand on your shoulder? Okay, other one. No crepitus noted. And now we're just going to go into some cerebellar flexions. So can I have you touch your fingers to your thumbs like an OK and go as fast as you can? Okay, and then have your hands straight on your thighs and go back and forth as fast as you can. Okay, perfect. And then one more, I'm just going to have you follow my pen by touching your nose to the pen as I go like this. Okay? Okay, perfect. Next, I'm going to check your skin turgor for tenting. No tenting noted. You are hydrated. So I'm going to check your cranial nerve 11. When I put my hands on your shoulders, I want you to resist and shrug up. Okay? Okay, your cranial nerve 11 is intact. So, moving on to your head. Do you have any headaches or concussions? No brain surgeries or nothing like that? Okay, I'm just going to palpate your scalp and feel for any lesions. No tenderness here? Nope. Okay, and I'm going to do a strand test. No strands noted. Do you dye your hair?
Yeah.
Do you use any products? Yeah. Okay. And next I'm going to palpate your lymph nodes. So I'm going to feel for your occipital lymph nodes, your postauricular lymph nodes, your preauricular lymph nodes, your submandibular lymph nodes, your submental lymph node, and then I have you shrug your shoulders up, your supraclavicular lymph nodes, and then your deep cervical chain lymph nodes. All lymph nodes are non-palpable. Now I'm just going to move on to your face. I'm looking for symmetry. Everything seems to be in line. I'm going to feel for your sinuses. Can I have you move your glasses for me, please? So I'm just going to palpate your frontal lymph nodes, or your frontal sinuses, and then your maxillary sinuses. Any tenderness? Okay, perfect. I'm going to test your cranial nerve 5, which is your trigeminal. So I'm going to have you clench your jaw. Okay, I'm just feeling for muscle tension. Okay, and then I'm going to touch this to different parts of your face, and I'm going to have you close your eyes. You can tell me like forehead, right cheek, chin. Yeah.
Forehead, chin, right cheek, left cheek.
Okay, cranial nerve 5 is intact. Next, I'm checking cranial nerve 7, which is facial expression. So I'm going to have you give me a smile, frown, puff out your cheeks. Okay, cranial nerve 7 is intact. So next, we're going to move on to your ears. Do you have your ears pierced?
Yes.
Okay, any past ear infections?
Yeah.
Okay, anything that's bothering you right now? Okay, so I'm just going to palpate your pinna. Pinna is equal bilateral on both sides, and if I have an otoscope, I would look into your ear, pull it up and back, and see that your tympanic membrane is gray and pearly and intact and shiny. And next I'm moving on to your eyes. So how long have you been wearing glasses for?
My whole life.
Okay, do you have any problems you're concerned about with your eyes right now? No drainage, nothing like that? Okay, so I'm gonna check your pupils. I want you to look straight at me. Okay, I'm gonna check your corneal reflex. Look straight at me. Your sclera is white, and your pupils are equal, round, and reactive to light. So next I'm going to check your accommodation. You're going to look at this pen. When I tell you to look back at this book, you're going to look back at it, okay? Okay, look back at the book. Okay, accommodation is intact. And then next I'm going to check your 6 cardinal fields of gaze. So you're going to follow this, the top of this, where I move it up with your eyes, okay? Okay, no stigmas noted. I just checked your cranial nerve 3, 4, and 6, your ocular motor, your trochlear, and your abducens. All seem to be intact and working perfectly fine. Okay, and then I'm going to take a look at your nose. Can I have you had any surgeries?
No.
Do you have a piercing?
Yes.
Okay, do you have any like problems, nosebleeds, anything like that?
No.
Okay, I'm just gonna take a look up inside of it. Have you look up? Okay, no deviated septum, and your membranes are pink and moist. And then now we're going to check your cranial nerve 1, your olfactory, which is a smell test. So I'm gonna have you close your eyes, and you're gonna tell me what it is that you're smelling. Can you smell?
No.
Okay, perfect. Cranial nerve 1 is intact. Okay, and next I'm going to move on to your mouth. So I see that your mouth, your lips are not dry and they're pink. Have any problems in your mouth?
No.
Any like cuts, lesions, pain? Do you have any cavities?
No.
Okay, and do you have any braces?
No.
Okay. So have you open your mouth for me? I'm just looking in. Teeth are all intact. Inside of mouth is pink. Can I have you say ah? Okay. Can you stick out your tongue and move it side to side? Okay, so I checked your cranial nerve 9 and 10, your vagus, and your glossopharyngeal, and then your cranial nerve 12, which is your hypoglossal. All seem to be intact. So next I'm going to be moving on to your throat. So I'm just checking for your trachea alignment. I'm going to feel for it. Trachea is in line. I'm going to listen for your carotid pulse, or palpated. Carotid pulse is equal bilateral and +2, and I'm just going to listen to make sure you don't have any bruises in the area. Using my bell. No bruise noted. That's a good sign. So next I'm going to move on to your back. Can I have you turn around for me? Okay. So I'm just going to palpate your thyroid. Thyroid is palpable. I'm just going to deviate it to the side. Can you swallow? Okay, and then swallow the other side. Okay. Okay, and next I'm going to check for your chest wall expansion. So can I have you take a big deep breath in and out. Alright, checking for your chest bone alignment. Okay, so next I'm just going to percuss your lungs on your back. I'm just going to tap on it, okay? I'm just listening for resonance. Okay, resonance was heard. Next, I'm just going to listen to your lung sounds. So I'm going to have you take a few big deep breaths and let me know if you take any breaks, okay? Big deep breath in. Out. In. Out. Okay, lung sounds are clear. No masses or liquid heard. Okay, can I have you lay down for me? And while you're laying down, I'm just going to check my sheet and make sure I haven't missed anything. So I'm just going to assess for JVD, so I'm going to have you look to the right. Okay, and look to the other wall. Okay, no JVD noted. And then I'm going to give this over to you so we can see what I'm doing. Is it okay if I pull this down?
Yeah.
Okay. And then before I get started, I just wanted to ask, on a scale of 0 to 10, what would you rate your pain today?
0.
0 pain? Okay. Do you have any problems with your chest?
No.
No problems with your chest? No pain or nothing?
No.
Okay. I'm assessing it. It looks good. There are no cuts or bruises. So right now I'm just going to listen to your heart sounds. Okay, I'm listening for your second intercostal space. On your right, your aortic valve. And then use my bell. Okay, next I'm doing your second intercostal space on your right side, your pulmonic valve. Now with my bell. Right, and your third intercostal space, your herbs. And then your fourth intercostal space, your tricuspid. Okay, and now I'm going to listen for your fifth intercostal space, your mitral valve. Okay, and I'm using my bell. Okay, and now I'm going to listen to your apical pulse for a full minute. Starting right now. Okay, your apical pulse is 82 beats per minute. Okay, we're done with the chest area. I hear no heart murmurs and no bruise. So I'm just going to move this up. Is it okay if I pull up the bottom of your gown to show your abdomen?
Yep.
Okay. I'm just going to pull this down a little bit. Okay. So right now I'm assessing and inspecting the abdomen. I don't see any cuts or bruises or ascites, and fat distribution is equal. Is you have a tattoo here? Is there any problems with that?
No.
No? Okay. You had any problems with bowel movements?
No.
Nothing? Okay. So right now I'm just going to listen to your bowel sounds in each quadrant. So I'm going to start with your right lower quadrant. right upper quadrant, left upper quadrant, left lower quadrant. Okay, patient's bowel sounds are active, 5 or more bowel sounds per quadrant. So next I'm going to listen for any bruits and the arteries that are in the abdomen. So I'm going to start with using my bell, I'm going to listen for the aortic artery. Right renal artery. Left renal artery. Right iliac artery. Left iliac artery. I'm moving on to the femoral pulse. Is it okay if I lift this up?
Yep.
Okay. Left femoral pulse artery. Right femoral artery. Okay, and while I'm down here, I'm going to palpate for your femoral pulse. Femoral pulse is equal bilateral and +2. So next I'm going to percuss your abdomen and I'm listening for tympani sounds and making sure there are no masses. So I'm going to start on your right lower quadrant. Okay, sounds as tympani and no masses felt or heard. So now I'm just going to feel for your liver border. Liver border is right here. I'm going to percuss the liver border now, starting from the right lower quadrant. Okay, liver sounds dull, which is completely normal. And next I'm going to palpate your abdomen. So are you having any tenderness or pain?
No.
Let me know if you start to feel any while I'm palpating. So first starting with light palpation in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, now I'm going to do deep palpation. Any pain?
Nope.
Okay. No masses felt. So next I'm going to move on to the legs. I will go ahead and set this back over here. See, make sure this is all good. Okay. So right now I'm just looking at your legs and I don't see any scratches or bruises, any pain in your legs. Nope. So I'm going to feel for your muscle tone. Equal bilateral and your temperature is warm. And your cap wrinkle on your toes is less than 3 seconds. And then, can I have you lift up your legs a little bit? So I'm feeling for your popliteal pulse. Okay, and your dorsal pedis pulse. And your posterior tibialis pulse. All pulses are equal bilateral and +2. So next I'm going to do a touch sensation test on your legs. So what I'm going to do here is touch a dull side or a sharp side. You're going to tell me what area of your leg and if it's dull or sharp. And you're going to close your eyes, okay? So this is dull and this is sharp. You can feel the difference?
Yep.
Okay.
Sharp on my upper left eye. sharp on my calf, my left calf. Sharp on my right calf. Soft on my left calf. Soft on my right calf.
Okay.
Soft on my left foot underneath. Soft on my right foot underneath. Sharp on the top of my foot, left. Sharp on the top of my foot on the right.
Good. Patient was able to tell the difference between all soft and sharp points. Okay, if I could just have you sit up and have your legs over the edge of the bed. Okay, so right now I'm just going to do some more leg tests. Can I have you kick out this leg? Okay, kick out this leg. Okay, no crepitus noted in either of your legs. And then can I have you circle your ankles? Put your Okay, put your ankles inwards. Put your ankles outwards. Okay, and then can I have you resist me pushing up? Resist me pushing down, resist me pushing in, or resist me pushing out. Okay, and do you feel any dizziness right now?
No.
No dizziness? Okay. And before we go to the next step, I'm just going to check my paper one more time to make sure I'm not missing anything. Okay, so now I'm just going to check for edema. No edema noted. And then I'm going to check your reflex. Okay. Reflex is working in the patient. And then could I just have you put on your socks and shoes for me? You're not feeling any dizzy? You feel like you could stand up right now?
Yep.
Okay, perfect. Okay. So now we're going to do the Romberg test. So what I need you to do is just stand with your feet apart and then your arms out and close your eyes and keep it that way for 20 seconds. And I'm right here in case you fall. Okay, negative Romberg test. You are coordinated and not wobbly. And your cranial, also tested for your cranial nerve 8, your auditory, so that means your gait and your balance is good. So next I'm going to have you just walk with me a little bit. We'll start right here. And we're just going to walk just like normal. Walk with me over here. Okay, and then turn around, and then we're going to walk heel to toe back. I'm right here with you. Okay, perfect. Feeling dizzy? Nothing?
No.
Everything? Okay, we'll sit down. And so I rate you a 23 out of 23 on your Braden scale, which means you are not at risk for any pressure ulcers. You are active and you are very mobile and you have a good diet and your skin is dry. Any questions?
Nope.
No questions? Okay. Thank you for doing this assessment with me.
All right, thank you.